Welcome to my channel, the HEMA Pharmacy. Today we are going to discuss about the difference between the C-section and also an normal delivery. Okay, the first delivery is very important for a pregnant woman. If you have a cesarean section in the first delivery but not normal delivery, your next delivery will also be a C-section. So, all women should be very careful about their first delivery. If the first delivery is a normal delivery, the second will also be a normal delivery because of these stitches. Okay, this is the general topic which is very important, which is very useful to the ladies who are pregnant. And the first delivery takes time, but the second delivery doesn't, because it takes time for the pelvis to open during the first delivery. For some women, the first labor takes 10 hours and the second one only takes 2 hours. The difference means the pelvis will be enlarged by the first delivery. You should keep this in mind and improve awareness about the pregnancy, which is very important to pregnant women and also ladies also. Read some books and watch the videos which is useful to about the which is giving useful information about the pregnancy and delivery, like like our channel HEMA Pharmacy. Okay, talk to your gynecologist and find out what to do have a normal delivery, what to do to have a normal delivery. If you ask me, I would suggest paying the doctor more for a normal delivery, because of the normal delivery it is uncertain, it may happen even during the midnight also. Discuss with your doctor that you are ready for a normal delivery. You have to follow some precautions and some exercises before the delivery. Okay, normal delivery is longer because of the heavy pain, and it is very not harmful, it is very painful, and it is very hard also when compared to the cesarean section. Sometimes the doctor may have to stay with you for 10 hours past midnight. It takes only 5 minutes to deliver a baby by a C-section. But in the normal delivery, it takes longer time when compared to the cesarean section. So discuss your plan with your doctor clearly, and also your family members, especially with your husband. Okay, let them know your preferences. Try for normal delivery and know what is needed for that, because of the some kind of body which is uh, very flexible to the normal delivery. In some persons it doesn't happen because of the body and their functional system. So take care for the first pregnancy, because the outcome of the second pregnancy depends on first pregnancy. Let me tell you why a C-section can happen the second time if it happens the first time. The first time the uterus is cut and the baby is taken out, the skin becomes a scar after the being sutured. In the second pregnancy, the scar may not have the strength to bear the baby's weight. In the second pregnancy, the scar may not have the strength to bear the baby's weight. So that's why the after hysterectomy, the incision scar cannot be strong. Hysterectomy means a surgical operation which removes the all parts of the uterus. A surgical operation to remove all parts of the uterus. After this hysterectomy, the incision scar cannot be strong. If the baby grows more in the second pregnancy, the scare will be breakdown, and instead of the baby coming from the second cesarean section, the scare ruptures and the baby's head emerges from its. Sometimes the scare ruptures and the baby is delivered into the stomach, means in the intestine. Then what happened? The baby will died in the mother's stomach. Okay, the baby enters the stomach between the intestines. If this happens, the baby will die within 5 minutes. When the scare ruptures, the blood flow will be increased in the walls of the uterus. This is the dangerous for the life of mothers too. So, when the scare ruptures, the blood flow increases in the walls of the uterus. It can cause the death in the pregnant woman. Therefore, no gynecologist or pregnant woman will take this risk. Normal delivery after the cesarean requires medical experience. Means the doctor should have a lot of courage and constantly monitor the patient. And she should be able to take care the decision of cesarean when necessary if the second delivery time. After a C-section, it happens a normal delivery. It is called as the vaginal delivery after C-section, VBAC. Okay, VBAC means vaginal delivery after a cesarean section. There are women who have had a VBAC but under very careful supervision. So remember that the first delivery is very important, and it will determines the next delivery, as well as it very secured. Okay, so we have to take care about the first pregnancy as well as second pregnancy. The first pregnancy decides the second pregnancy. Okay, and pregnant women should have to take the care, and also the baby also, to help to grow the baby healthy. The pregnant women have to do the some yoga poses and some exercises to deliver the normally. So these are about the difference between the C-section and normal delivery. Okay, thank you so much for watching.